is Dahianna Campos. Actually, I work at East Boston Neighborhood Health Center as a psychosocial support. I didn't know that I want to become a doctor, but what I knew was I like to help people. So I studied for 6 years and I get my medical degree. Then I work as a doctor, basically a general practitioner, for 6 years. Then everything changed when my husband and I decided to come to the United States. When I had my appointment, my first appointment here, I realized that everything is different. As an immigrant, it's hard to come here and you don't know where to go, how to ask, how you can express yourself in a different language. I want to do something where I can be the bridge for communities and the healthcare system. I went to Asian Women for Health and they offered me that training. And then in my first day in that training, I felt, oh, this is the place that I was looking for all this time, because at that time was 4 years trying to find my place in this country where I can be useful for the system. So when I was there, I was so happy because I found that place. And also, they give me the opportunity to recover what I miss the most, helping people.
I actually come at this from being a community health worker myself, first professionally back in 1991. But before that, I came from an immigrant family that didn't speak English. So I was always that bridge between my family and the healthcare system and school system and the community, because it was difficult for my family members who didn't speak the language to navigate systems in the United States. One example that I love to give is a story of a patient who had 54 emergency department visits. And emergency department visits are really costly to healthcare systems. And when people are there unnecessarily, it uses up a lot of resources that could be better used. And once that person was assigned a community health worker, and the person understood, this is when you go to your regular doctor, this is when you go to the emergency department, this is when you go to urgent care. The emergency department visits went from 54 in a year to 4 in a year.
Community health workers have a lot of different needs of tastes. There is a lot of opportunities, so take your time to decide what did you call it? They don't only give me the knowledge, they support me to find out that my experience as a general practitioner in my country is valuable. They believe in me and I didn't believe in myself, but they helped me to realize that.
A lot of the work is about becoming more familiar with systems in the US, understanding what the code of ethics are. So we have discussions with the group about the challenges of both being part of a community and at the same time being part of this healthcare system, and it can present some difficult situations for them.
When you get used to something, you forget how hard it is for patients. You forget how hard it is to step into that culture. And it is such a rigid culture.
A lot of the course is really focused on having people understand what these jobs look like, what some of the expectations may be of them. We really talk about professional roles, professional values.
During the classes, I learn more about culture, more about this system and how we can provide that help and support for communities. I learned that I don't have to worry about my accent because you feel that you need to sound like an American people. I learned that I have to be proud of my accent and it's part of my culture and I don't have to change it just because I live here.
I like to say CHWs can usually speak shorthand to the client. And in addition to that, a doctor may have 15 minutes, 20 minutes with a patient, yet a lot of health happens in the home, right? And in the community, and the CHW knows what the context is in the community.
And part of that bridge work is remembering those emotions and helping people to navigate that.
One of the questions I will often ask community health workers is how many of you have patients who share really important health information with you that they've not shared with their doctor? Every hand goes up. And so a lot of this has to do with the trust that's established between a CHW and the patient. We can teach theory, we can present frameworks, but it's really people's experiences that bring things to life in stories. We like to say that stories are a form of data, but it's data with a soul. And as we have the students in there, we see that they've gone through, may still be going through some of the struggles that the people they will be serving later on will be going through. And I think having people who are not yet community health workers is even more enriching for us because they're learning this information for the first time, most of the time, but it's combined with this excitement of moving into a helping profession.
You can make your dreams true. I understand that it's hard to find out resources, but you can make a change and you can think about what matters to you. Go to the English classes, use every resources that you have, and then when you feel prepared, find what you need to make your dream come true. Sometimes you will struggle with things, but when you struggle, you learn.